and at least you have got it on the record. Right, let us move on. I'm now going to come to the 10-minute rule motion. Munira Wilson.
Thank you, Mr. Speaker. I beg to move that leave be given to bring a bill to make provision to require every school to have access to a qualified mental health professional and for connected purposes. He used to be such a lovely, happy little boy, and now he's so sad. I'm terrified for his future. And all I've ever wanted was to help my son, and I've failed and fallen at every hurdle. The anguished words of my constituent, who is mother to a 9-year-old. Week in, week out, I speak to parents whose children are struggling with their mental health and struggling to access appropriate support. When I speak to head teachers, they tell me that some of the most pressing challenges facing our education system come from outside the classroom, and mental health is amongst the biggest. Teachers often feel like they're the fourth emergency service, filling the gap left by under-resourced services right across the country. Now, let's be clear, mental health services for young people before the pandemic were inadequate. Since the pandemic, despite the best efforts of everyone working in the sector, services are on their knees. This current generation of children has had to contend not only with rising pressures and judgments brought by social media, but also with the huge consequences of a global pandemic. It is unsurprising that these challenges have taken their toll on children and young people's mental health. It is estimated that 1 in 5 children between the ages of 7 to 16 have a probable mental health disorder. Mr. Speaker, if 6 children in every classroom were diagnosed with a physical condition such as diabetes, there would be a public outcry and there would be no discussion about urgently putting both proper treatment and preventative measures in place. We would just do it. Mental health is no different and should not be treated any differently. We must do everything in our power to ensure that every child arrives at school happy, healthy, and ready to learn and thrive. My bill provides one of the tools to help achieve that. It would place a dedicated, qualified mental health practitioner in every school, primary and secondary, giving every child in school access to care and support from the moment they start needing it. Early intervention is crucial. Research tells us that half of all lifetime mental health disorders start before the age of 14. Stepping in as soon as warning signs start to show can often help to prevent conditions from becoming more severe. When Nicole, now aged 19, was struggling with her mental health, she had to wait a very long time before she could access any support. Describing that time, she said, "Waiting for suitable mental health support meant that my whole life felt like it was paused and erased. I was left without suitable support and my mental health left to deteriorate." This story is not unique, nor is it unusual. I know colleagues across this chamber are aware of many similar stories in their own constituencies. The state of our children and young people's mental health is a significant and urgent challenge facing our country. And frankly, this government is not taking it seriously enough. In December 2021, the Health and Social Care Committee warned that the combination of unmet need before the pandemic and additional needs created by the pandemic were significant. They said that the government's plans are currently not sufficient for the task at hand. In the 2 years since, there's no indication that their approach has improved. Last month, when I asked the Mental Health Minister in a written question what proportion of mental health funding had been allocated to children and young people, I received an answer that such funds are not separately identifiable. Mr. Speaker, how can a government even begin to take a problem seriously when they don't even know how much money they're spending on it? Sadly, too often, in the eyes of the Treasury, children and young people are seen as a financial burden and a drain on government resources. And this is just wrong. Spending on education and services to support our children is an investment in our country's future, in our children's future and our country's future. And it is time that the government recognise that. Now, the introduction of mental health support teams has been an encouraging step forward. but they are under-resourced and overstretched. Last year, I visited Carshalton Boys Sports College. I met both MHST staff as well as some of the pupils they were supporting. The boys talked about how the team had helped them learn coping techniques for anxiety and how to identify the techniques that work for them. The staff mentioned how important it was that they could intervene early before things escalate and children need other services such as CAMS. But what struck me was that this team was stretched thinly across many local primary and secondary schools, which meant their valuable skills and service were only available for half to 1 day per week in each school. Furthermore, research by the Liberal Democrats revealed that by the end of this year, half of secondary schools and 3/4 of all primary schools in England will still have no access to mental health support teams at all. Instead, the role of supporting children's mental ill health falls on teachers who are already managing a heavy workload at the same time as contending with extremely overstretched budgets. With many schools struggling to afford the basics, sadly some of those who have found the money, their own money for mental health support, are being forced to cut back, which is why schools must not have to fund this provision themselves. My bill makes clear that funding needs to be made available for this proposed statutory duty for all state schools. Using the polluter pays principle, Liberal Democrats have proposed funding these mental health practitioners through tripling the digital services tax on our big social media companies, given the harm that they have contributed to our children's mental health. Mr. Speaker, a big challenge currently facing schools is persistent absence, with the most recent government data revealing that 1/5 of children missed on average a day of school every fortnight last term. One of the most significant causal factors of absence is mental ill health. According to new data from Young Minds, more than 1 in 5 children waiting for mental health support have missed more than 6 months of school. Absence has a huge impact on child's education and ultimately their prospects. 3/4 of these children said they had stopped exercising, doing hobbies, and even seeing their friends. These children should be carefree, enjoying themselves and spending time with loved ones. Instead, their lives are being put on hold, their life chances diminished because they can't access the support they've so bravely asked for. And just last week, I heard of a pupil at a school in my constituency who is stuck in exactly that limbo. Despite desperately needing mental health support, they're stuck on a long CAMS waiting list. In the meantime, not only has the child stopped attending school, but their mother said they have not left the house for over 4 months. A teacher at the school told me that they strongly believe if there had been the possibility of being seen by a mental health professional at school on a regular basis, this pupil would still be attending school. Instead, their mental health is rapidly deteriorating, leaving those around them worried sick. Sadly, this is not uncommon. In fact, the head teacher of this pupil alarmingly told me this was just one example of many. Mr. Speaker, there is a tidal wave of mental ill health among our children and young people. It is jeopardising their well-being, their education, their prospects and their long-term health. A report commissioned by the Local Government Association, undertaken by the Children and Young People's Mental Health Coalition, asserted that there is a missed opportunity to significantly ease pressure on the system by increasing the availability of preventative and early intervention support. This is exactly what putting a mental health practitioner in every school would do. It would make mental health support accessible to every pupil, regardless of their age, where they live, or what their background is. It would save our NHS money in the long term by tackling issues before they become severe. And it would ensure that children's mental health is supported early on, giving them the tools they need to be resilient and thrive into adulthood. Mr. Speaker, this bill is an investment in our future, and it is an investment we must make, not just because it's sensible, but because we owe it to this generation of children and young people, a generation that so often feels let down and neglected. I would like to end by thanking the young people, parents and teachers who've shared their stories with me, as well as the organisations that have supported me with this bill, including Young Minds, the Centre for Mental Health, Barnardo's, Place to Be, BACP and the Sutton Trust. They are all dedicated to ensuring that every child has the right support in their time of need, and this bill would be a significant step towards achieving this. Thank you.
That the honourable member have leave to bring in the bill. The question is that the honourable member have leave to bring in the bill. As many of that opinion say aye. Aye. The contrary, no. I think the ayes have it, the ayes have it. Who will prepare to bring in the bill?
Davey, Daisy Cooper, Helen Morgan, Layla Moran, Sarah Dyke, Richard Ford, Sarah Green, Sarah Olney, Tim Farron, Vera Hobhouse and myself, Mr Speaker.
Munira Wilson.
Schools Mental Health Professionals Bill.
Second reading what day?
Friday the 21st of June.
Friday the 21st of June.
Yes.
Okay.